Hi there, my name is Jonathan Shoehead, and I'm an orthodontist in West Los Angeles, California. I'd like to take a moment to discuss safety in the dental office. Since the early 1990s, dentists have been using something called universal precautions. Universal precautions are an industry-wide sterilization guideline that help prevent transmission of the most deadly and resistant diseases. They help prevent doctor-to-patient, patient-to-doctor, and patient-to-patient transmission of disease. Universal precautions work, and as a result, dentists are very familiar with preventing disease transmission in their offices. Today we're faced with a new crisis. COVID-19 has changed the way we view the world around us, and so I thought it was important to clarify how a dental office is different than your typical establishment, and how they are ready to provide you dental treatment in a safe environment. Universal precautions require that all commonly used areas be covered with barriers, and that all surfaces be disinfected between patients. Typically, we use barriers to cover handles and commonly used areas. We use chair covers to limit patient contact with our chairs. We use sleeves to cover our instruments to help keep them isolated. And even though isolation limits contact, any area in contact with the patient needs to be wiped down with one of the strongest disinfectants known to man called Cavicide. Cavicide kills bacteria, it kills fungus, and it kills viruses, wiping away anything that could pass disease. Dental offices, after every single patient, wipe down chairs, countertops, door handles, cabinet handles, and anything else that a patient's fluids may have come in contact with. For critical items that come in direct contact with a patient, we require a higher level of cleaning called sterilization. This process involves extreme temperatures and pressures on the instruments, which guarantees that no living thing could survive on them. The point is, we as dentists take disinfection very seriously. So for dentists who are already good at keeping our areas clean, only a few adjustments are needed to prevent the transmission of COVID-19 in our offices. Here's what we're doing. Number 1, all patients should indicate if they've been having symptoms of COVID-19 and have their temperature checked when they arrive on site. If you have or have had symptoms of COVID-19, you shouldn't be in the office. 2, if you have a face covering or mask, wear it to your appointment and take it off when you sit down in the dental chair. 3, if available at the office, wear footsies or booties to cover shoes. 4, avoid sitting in the waiting room. You can call ahead to the office and wait in your car for your appointment. 5, patients should wash their hands as they enter the office and just before leaving. 6, dental offices should be practicing social distancing. The fewer people in the office, the better. 7, when providing treatment, many dentists are using level 3 or N95 masks. Most will be using face shields, and all dentists will be wearing gowns to protect their skin and clothes. Staff should also be wearing protective gear. And finally, among other precautions, procedures that can create sprays that can spread saliva should be done in private rooms. Now, this is not the entire list of ways that we keep our offices clean, but I do hope this has been informative for you. And as we get back to normal from the COVID-19 pandemic, I hope you remember that dental offices are ready to fight any source of infection and are a safe place for our community. Thanks for watching. I wish you and your families good luck and good health.